Despite the continued challenges of COVID-19, the members and communities of the HIV Prevention Trials Network, HPTN, remain focused on advancing HIV prevention research in 2021. In late December, the U.S. Food and Drug Administration approved long-acting cabotegravir, or CAB-LA, injections for pre-exposure prophylaxis, PrEP, to reduce the risk of HIV acquisition among adults and adolescents behaviorally vulnerable to HIV acquisition. The approval was based primarily on efficacy data from HPTN 083 and HPTN 084. The two studies showed a PrEP regimen containing CAB-LA injected once every 8 weeks was superior to daily oral tenofovir emtricitabine for HIV prevention among cisgender men and transgender women who have sex with men, HPTN 083, and cisgender women, HPTN 084. Two additional studies looked at whether CAB-LA is safe and acceptable for adolescents. HPTN 08301 focused on adolescents assigned male at birth, including men who have sex with men, MSM, transgender women, TGW, and gender nonconforming people, while HPTN 08401 focused on adolescent cisgender females. Both studies contributed early safety data regarding adolescents. Marketed by ViiV Healthcare under the brand name Apretude, CAB-LA offers adults and adolescents a new PrEP option for HIV prevention. The HPTN continued its partnership with the HIV Vaccine Trials Network, HPTN, to evaluate several MABs for HIV prevention. During January's International HIV Research for Prevention Conference, or HIV R4P, researchers reported results from the proof of concept AMP studies. These studies demonstrated that a broadly neutralizing antibody, or bNAb, called VRC01, effectively prevented the acquisition of HIV strains sensitive to that bNAb. However, VRC01 did not significantly reduce HIV acquisition overall in either AMP study. Ongoing studies are examining other bNAbs alone or in combination. These studies may serve to inform future HIV vaccine development. Since the opioid overdose crisis remains one of the most widespread behavioral public health problems, the HPTN initiated HPTN 094, the Integra study. Launched in June, the study will help determine whether using mobile health units to deliver integrated health services for people with opioid use disorder in the United States can improve HIV and substance abuse treatment and prevention. Another population considered a priority for HIV prevention and treatment is transgender women. HPTN 091, or the IAM study, is the first HPTN trial focused solely on transgender women. The study opened for enrollment in March and will assess the feasibility, acceptability, and preliminary impact of a multi-component strategy that provides HIV prevention services, gender-affirming hormone therapy, and peer health navigation to improve PrEP uptake and adherence. Additionally, Black men who have sex with men, MSM, in the U.S. South experience a greater proportion of new HIV diagnoses than all other regions in the country combined. HPTN 096 will assess an integrated HIV status-neutral, population-based approach to reduce HIV incidence among cisgender and transgender Black MSM. In September, HPTN 096 study team members held a public randomized event to assign 16 participating communities to either the intervention or standard of care study arms. Before full implementation, researchers will conduct a pilot to establish partnerships within each participating community, implement the intervention components in select communities, identify challenges, and improve the integrated strategy. HPTN researchers also contributed their expertise to address the ongoing SARS-CoV-2 pandemic as part of the COVID-19 Prevention Network, CoVPN, and led several studies evaluating vaccines and monoclonal antibodies for the prevention of symptomatic COVID-19 infections. As we move forward in 2022, HPTN researchers will continue evaluating biomedical interventions for HIV prevention and the use of integrated strategies to prevent the spread of HIV, including substance abuse and behavioral risk reduction interventions, and lenacapavir among women and in people who inject drugs in the United States communities. We remain grateful to our network members, partners, research teams, funders, community organizers, stakeholders, and, most of all, our study participants. They have supported our ongoing research agenda to end the global HIV epidemic. Thank you all for your continued hard work, dedication, and passion.